we are going over appeals. And again, this may sound like a super dry topic, and it is. However, if you have ever had a claim that was denied and you believe it was denied incorrectly, this is going to be a very significant personal and sometimes emotional issue for people. And I want to be here as a resource to help you and others, and of course my clients, go through these steps and know when it is appropriate to file an appeal. Now, I may not go over every single situation, of course. I'm going to try to keep it as short as I can while trying to give you important details. And I'm thinking of a very specific situation that I see come up most often, and I'm going to use that as an example here in this video to keep it short, to help you understand exactly when you should file an appeal, and you can understand the process a bit better. So with that, and so that you can understand the process a bit better, give you some concrete examples. So who am I? My name's Melissa DeWeese. I've worked in the insurance industry for 20 years. Please note that this is not medical advice. I am not your broker. I do not know the details of your plan. Please consult your evidence of coverage, your benefit summary, your summary of benefits and coverage, your plan booklet for all of those details, or even contact your own broker directly for more information. I am going to launch into this, and many people assume if they go to an out-of-network provider during an emergency, they have to pay the full cost. And I am going to debunk that and state that in many plans, most people have ACA compliant plans, and most states have laws to protect their citizens against billing their hospitals, these out-of-network hospitals, billing for emergencies. Now, the definition of an emergency in layman's terms is fear of losing life or limb, which is extremely important, and I'll get into that in more details later. And again, a little disclaimer here, I'm not a legal professional. This is not legal advice. So if you as a member have the layman's understanding of an emergency, which is you personally are in fear of losing life or limb, and it turns out at the end of the day that you go to the emergency room. Let's give an example here to help bring this home. Let's say I have chest pains. I go to the emergency room, the nearest emergency room, because me being a layman, I think I'm having a heart attack. Turns out it was indigestion. So obviously that claim is going to likely be billed. You know, if you're going to an out-of-network doctor or out-of-network hospital, it's going to be billed as out-of-network. You're going to get a big fat bill and have a heart attack when you get all these bills from going to the hospital, right? However, because you are not a physician, you're not a medical professional, you're not expected to diagnose, and you were in fear of life or limb at the time you entered the hospital, that can be defined as a true emergency, and the claim can be reprocessed. Now, this doesn't happen automatically. Nobody can read your mind. All of these insurance claims reviewers and AI that's processing these claims don't know the context of that situation. No one knows what was in your mind when you entered in that hospital. All they know is the information that was given to them by the hospital and the claims codes and all of that insurance-y mumbo jumbo stuff, right? So when these sorts of things happen, a appeal should and likely will have to be filed to hold the insurance company's feet to the fire to pay the claim appropriately. So this process that we are going to go through is a guide and helping you understand kind of the steps that are included in that, so you can set your expectations and know how much time and dedication, and what I have found in my experience in working in this industry for over 20 years now as to what the steps are with most insurance companies. So specifically, I state California law here, and California law states that health plans are required to cover emergency medical services without requiring prior authorization and without imposing higher cost sharing simply because a facility provider is out of network. Specifically, the California Health and Safety Code 1371.4 mandates that insurers provide coverage for emergency services necessary to stabilize a patient, regardless of whether the provider is in network. So they have to see you. They have to treat you when you show up to the emergency room. And also there is a federal standard that requires that emergency care be covered when a reasonable person would believe that delaying treatment would result in serious harm. So again, my layman's terms of fear of life or limb works, and I think it's easier to remember, including risk of life, bodily function, or long-term health consequences. So for example, if you're in fear of losing hearing or eyesight, it doesn't just have to be life or limb. It could be permanent damage to your eyesight or permanent damage to your ear or something like that. Initial claims processing: after your visit, your healthcare provider will submit the claim to your insurance company. And again, when it goes through and the codes come through as something that doesn't sound like it's a true emergency, and even things that do sound like an emergency, I've had all sorts of awful things, like people having seizures or aneurysms and cancer and all sorts of serious conditions be denied when they're in an emergency. And so most insurance companies will deny first and ask questions later. Step 2 is insurance company initially processes the claim as out of network. That's usually what happens when you go to an out-of-network facility. That's just usually how it goes, unfortunately, even if it is an emergency, even if the codes and all of the language of the claim looks like it could be an emergency, they're usually just going to assume it's not and pay out-of-network. Most people stop here and pay the bill. They say, oh my gosh, this was an unexpected bill. I'm getting all these calls from these collections agencies, and it's really scary and it's very confusing. Most of the time when you do go to the hospital, people have 5 different bills that come from 5 different places. If you took an ambulance, you get an ambulance company bill. If you saw a doctor, which of course you probably did, you get a bill from that doctor's group, usually emergency group physicians or something like that. You get a bill from the anesthesiologist. If you had any kind of anesthesia, that's usually a separate bill. If you had any kind of lab work done or an x-ray technician come in, that can often be a separate bill, and so on. And then a bill from the hospital, the actual facility that you saw. So most people stop there and pay, but instead you should appeal the decision if any of this rings true for you and you think that it should be paid, or you had any inkling that you were in fear of life or limb the moment you stepped foot into an emergency room, you should appeal it, at least try. If your situation qualifies as an emergency, the claim should be reprocessed as in network, even if the provider was out of network. Definition of an emergency is reasonable person who believed their life, limb, eyesight, hearing was in danger if they didn't receive care. How to appeal: you write a letter to your insurance company explaining why the visit was an emergency. This is where ChatGPT comes in extremely handy. Most people do not know how to write a legally official, letterhead kind of looking letter. That's okay. We have these wonderful AI tools. Most people can have access to these tools for $20 a month or even for free. And they do a pretty good job if you give accurate information in your prompt. When you write a prompt into ChatGPT, hopefully most of you know how to use it. If you don't, there are tons and tons of YouTube videos on prompts and how to write it. Of course, always reread the language that is in the letter. Make sure it makes sense to you. Also, I've seen that ChatGPT leaves fields open. So even if you tell it the hospital that you went to, it may bracket out provider name or hospital name. And if you don't read through that, you don't catch that and fill it in properly, then the insurance company may ignore the letter and say, all the information wasn't in the letter, so we're going to, dismiss this or delay it even further. And I've also noticed that every step of the way with claims takes about 30 days. And so if you do submit a letter, it wasn't correct, you had a typo or you didn't fill in all the information, and the insurance company receives it, it usually takes them 21, 30 days to send a response. And then you get it and you send another response, it's another 30 days. So this can go on for months and months and months and months. So my point is that if you do it right the first time, it's going to save you months of anguish. And also keep in mind that this is a patient person's process. You do have to just chip away at it. I personally and all my team set calendar reminders, excuse me, calendar reminders to check up on these things on a weekly or sometimes bi-weekly basis for these longer processes to stay on top of it. And again, just chip away at it. Submit your appeal through the insurance company's process. So some insurance companies do require you to make a phone call. Even with the phone call, I don't really like this method. I like everything in black and white in writing so that nothing can be taken out of context or misread. I like everything in writing, either an email or snail mail. So I always recommend people submit their letters with certified mail through USPS to the insurance company, even if their insurance company does require them to make a phone call, and then do make the phone call, but just read the letter. Just read the letter. Don't let them get you off track. Don't let them, just stick to what the letter says. And oftentimes again, I'm not an attorney. This is not legal advice. Look at, go talk to an attorney if you really want to. But I've found that including codes like the ones I listed here do go a really long way. And you can just kind of keep reciting those in the phone call, the appeals phone call, if you have to. But the appeals process is usually pretty simple if it is over the phone. I haven't heard of anybody really getting badgered over those phone calls or anything like that. So most insurers, some of them do require a written letter in a formal appeal. I've seen that for the more expensive appeals. However, we're seeing more and more that phone calls are also a requirement. Send it via certified mail to confirm receipt. This ensures that you have proof that the appeal was submitted. Also, little tip, before you send off the letter, take a picture of it, take a picture of the certified mail little green receipt you get from USPS, or scan and make a copy, send it to yourself, send it to someone to help you keep track. Always keep a copy of the signed letter. I've seen it where most 50% of the time I have to resubmit the letter. We do this a lot of times on behalf of our clients when we're helping them. Of course, we're not attorneys, and we clearly state that. However, and the client submits the letter, and then if they want us to follow up on it, we require a copy of the appeal that they submitted in writing, and therefore we can just forward the client's letter to the insurance company and say, where are we on this? Sometimes they say we didn't get it, but the fact that the client can prove that they did mail it kind of checks that box, and they move forward anyway, even if it got lost in the mail. It does help speed things along when follow-up is done via email. So you're not having to keep resending the letter over and over and over again. Again, saving months sometimes, 30 days here, 30 days there, just these little tips and tricks. So step 3, key point to include in your appeal: you are not expected to self-diagnose. Like I said in the beginning, you're not a doctor, you're not a physician. How do you know if you're having a heart attack? That's why you're going to the emergency room, right? If you have chest pains, just describe what you felt at the time you entered in the emergency room and why you went in, what you were afraid of. Explain why you reasonably believed your condition was an emergency. And then be specific. Were you in fear of losing your life? Did you feel like if you didn't go in, you were going to lose loss of your hand, your foot, your limb, your eyesight, or hearing permanently? Did you experience severe pain, difficulty breathing, or symptoms of a stroke or a heart attack? Be sure to include that. If yes to any of these, your visit should qualify as an emergency to be covered as in-network. Okay, step 4, what happens next? The insurance company reviews the case and determines if it should be reprocessed as in-network, and they are required to send you a letter in the mail as to what their decision is. If approved, your costs will be reduced and paid in network. If denied, you have additional appeal options, including state insurance regulators or an independent medical review. So there are steps, depending on your state, to go to your insurance commissioner and other different departments, depending if you have an HMO or a PPO sometimes, as to how you file those follow-ups. Don't accept an out-of-network emergency bill at face value. You have the right to appeal. Many claims are wrongly classified as out-of-network when they should be paid as in-network by law. Please take action. Follow this process. It is a simple process. It's not easy. I understand it's not easy. Most people hate having to go through and fill out that letter and go to the post office. And all of us are super busy, and I understand 100% that it is not easy. It is simple, but it's not easy. So again, this is not medical, legal, or financial advice. I'm not your insurance broker. I do not know your specific plan details, and I'm not an attorney. I'm just a person on YouTube with 20 plus years of insurance experience. I'm here to help you navigate this crazy system that is completely not intuitive at all. And if you found this video useful at all, please share it. I would love to hear from you. Love to hear if this helped in any way. And thank you for hanging out until the end. If you are an employer and you're looking to revamp your employee benefits plan, or you're just curious as to how your current employee benefits match up to today's work environment, I do have a link down below for a free consultation and assessment with me. And I look forward to seeing you next time. Ciao.